Good afternoon. Since the beginning of the crisis, we know that the most vulnerable to the virus are the elderly. We concentrate our efforts in our residences for seniors. But it's also very important that you all stay at 2 meters or 6 feet from each elderly. We're also already working with our public health experts to prepare the gradual end of the economic pause sooner than later. But we have to make sure that we restart the economy without restarting the pandemic. So I know it's tough to continue all our efforts, but as we say in English, April showers bring May flowers. It's from Félotier, by the way. So thank you all.
Good afternoon. I have many questions about seniors, CHSLDs, the situation in Saint-Dorothée. So what is the government doing to tackle the problems in CHSLDs, especially with the Saint-Dorothée case, to make sure that we don't have a shortage of staff anymore?
Yes, what we're doing is we're redeploying staff that is in other sectors of the health system, because we have a good situation right now in our hospitals, thank God, because the population has helped us in taking all the measures we've put forward. And so we have a good situation, so we're going to redeploy those staff. We're talking about nurses, we're talking about orderlies that will come to give a hand. It's already started. In Laval, they added 70 people, 70 staff members, in addition to the ones in place. So we're going to do that in all the CHSLD, not only those who are in éclosion, which are those that have more cases, but in all the CHSLD of the province, because we think that we have to really reorganize that the same staff is taking care of people in one unit versus another one, and the staff has to be in one establishment, not many establishments. For that, we need to add more staff. So that's what we're doing right now, and we're going to have also physicians coming to help us. We have almost 500 physicians, family doctors, who are going to help us all across Quebec to give more services in the long-term facilities. So we're going to reorganize in that way and protect the staff, protect the seniors. What we're saying also is that all the protective equipment has to be in place, and it's being done right now. It's been done for a while. If there are places that there are problems, we want to know, and we're telling the PDG, the Director Generals, that they have to provide, because our situation is better for the masks now, all the masks necessary in the long-term facilities. And we're going to test everybody. We're going to test the seniors. We're going to test the staff to make sure we know exactly where people have the COVID-19 and where, because you know that we organize the services in the long-term facilities between cold zones and hot zones, and even in between zones for people who have the COVID-19, those who don't have it. So we need to have that testing too. So we want to protect everybody, and this effort is our great, great priority since the beginning, and we're going to do everything we need to do to protect our seniors.
Mr. Legault, you started today to give a bit of hope to Quebecers, talking about restarting the economy. Is it a risky business to start doing this today, as we haven't reached yet the peak of the pandemic?
Yeah, I think it's important that managers, owners of different businesses, that they start thinking about a new way to work in the next weeks or months, but we hope in the next weeks. So I think it's important that I explain the criteria that we'll use in the next days and weeks about the 2 meters, about what do we do with the children of workers, what do we do with the collective transportation. So we have to change our way of dealing, of operating our companies. So I cannot do that alone. I have to have the input from the company. So that's why Pierre Fitzgibbon, Éric Girard, they are working with the representative of companies to see how we'll be able to reopen businesses if figures stay good in the next few days.
Samuel Pouliot, CTV News.
Hi. We just got a press release from the CIUS de l'Ouest de l'île de Montréal, and they say le service de prévention de contrôle des infections du CIUS et la DRSP ont décidé de ne pas faire de tests de dépistage à l'ensemble des résidents et ont plutôt opté pour un suivi serré des symptômes. How is this a good idea, and does it not go against what you just said about systematic testing of residents and staff in CHSLD?
Well, maybe Dr. Arruda will say something on that. This is something that we're implementing at this point, so we need to talk with the CIUS West de l'Île about that.
Okay. And today we learned that the Quebec government is buying 200,000 kits from Spartan Bioscience in Ottawa. How does the cost of these kits compare to traditional kits, and why will this method benefit Quebecers?
Oh, this is a great tool, and we're going to get them in a few weeks, and this is like you get the result in 30 minutes, and these are kits that you can bring on premises and in long-term facilities, for instance, in hospitals, and you test the staff, you test the patients. The benefits of that is great, so we hope to get them as soon as possible.
Thank you. So now questions sent by email. The first one is from Phil Autier, Montreal Gazette. For Madame McCann, can you give us example of what is being done to slow the spread of COVID-19 in seniors and long-term care centers besides sending in doctors and nurses? What is being done to concretely to protect people in centers where there are COVID-19 cases?
Well, to add staff is a very important measure because what it does is that it allows us to organize the long-term facility in a way where there's no contact between the zone where there are patients. It's already done, but to better organize the zones, the cold zones and the hot zones, meaning that you have staff that is completely devoted to each zone. You don't have staff that is going from one unit to another or even to one establishment to another. So that's what we want to do in long-term facility, to concentrate the teams, to dedicate them to a unit in particular, and not to have people go from one unit to another. So this is a very important measure that we're doing. And also the testing that I've spoken about. We're going to test the patients and also the staff and the protective equipment that we're supplying as needed.
And now second question from Phil for Mr. Legault. People are so worried about family members and friends in long-term care and seniors residence. We are hearing about dozens of outbreaks on the island of Montreal. What do you say to people helplessly watching their loved ones sick or dying?
Yeah, well, I think we started taking precautions very early. A few weeks ago, at the beginning, we stopped the visits. Unfortunately, they had some visits before from their family, and some of the seniors were infected. So we're dealing now with the workers, the people, nurses, the doctors working in those centers. We are testing them to make sure that they don't infect people living in these CHSLD or other places for seniors. But I think we expected that. I think we said it. Now 90% of the deaths are people of 70 years old and more. And of course, in CHSLD, people, they are already sick. So they are very vulnerable. But we're trying also to transfer some of the doctors and nurses coming from hospitals in those centers to help making sure that we control this situation.
And now the next question is from Raquel Fletcher, Global News. Why are patients from CHSLD in Montreal Nord being transferred to a hotel in Dorval? The patients suffer from Alzheimer's and moving them can be very disruptive. Family members want to know why not move hospital patients with light cases to hotels to free up beds instead.
I'm presuming this decision, and it's been discussed in the past. You remember probably that we mentioned that we had the 4,000 rooms, hotel rooms, to help us. And I presume, because I would have to double check, that the decision is to protect those people from from the situation of the COVID-19. Those people don't have symptoms or don't have the COVID-19. So to put them in a hotel in a protective way, away from other units in long-term facilities who have COVID-19 is a move to protect them. That's what I presume has been done.
Thank you. And as a last question, can Mr. Legault or Minister McCann react to Jean Truchon pushing up his assisted suicide date? He was supposed to die in June, but was living in assisted living, having no family visit and frightened of COVID-19.
Well, maybe I'll start,
Yes, sure.
but just say that first, this guy had a lot of courage. He helped everybody in Quebec making tough decisions. Of course, we continue to study in which cases it would apply, and in respecting, of course, the will of the people, but putting also some parameters to make sure that there's no exaggeration or no special cases. Peut-être Daniel.
Well, I would say, like the Prime Minister, that our thoughts are with the family of Mr. Truchon and Madame Gladu. Played a role, a very important role in l'aide médicale à mourir and the availability. And we continue, of course, to work in terms of giving l'aide médicale à mourir in the best way possible. So I salute Mr. Truchon. I salute him. And I hope that his passing away was in the most serene way. I really salute him.